And all I had to do was a CT scan and a stress test. I do my CT scan. The doctor calls and says, Shana, your right kidney lit up like a Christmas tree, and there's 70% chance that it's cancerous. And I was like, what? Now that we've gotten my donors ready, we're 6 weeks out from setting a date, and the same kidney we've been looking at for 5 years at this point, now it has cancer? What is happening? Over and above their medical experience, because the one thing all the doctors had in common were they're very experienced. They knew what they were talking about. There was nothing wrong with what they were sharing, but it was in the how, and it was in the value system. So I started to look for doctors who, one, couldn't sleep unless they solved a problem, that liked challenging issues, that wanted to discover something new, that were into medical research and evolving, that were connected both from a medical standpoint, but also understood the non-medical factors that contribute to symptoms and to health. And then the fourth one was, I wanted doctors that were spiritual, that believed in something bigger than themselves. Because even at that point in time, I got like, this is going to take more than what I know as an individual. It's going to take something different to help me get through this. So that's where my 4 main areas that I would look for in each doctor. And I was very specific about it. And then if I couldn't put my finger on it and I just didn't like the vibe, if something just didn't quite feel right, I would just say, I don't even know why, but I want a different doctor for that.
Good for you that you were intentional about your choices, because often it is that, just go see this person down the street who has a big degree. But the science actually agrees with you that the doctor-patient relationship, yes, of course, you need the skill set, you need the degree, you need the science, but medicine is really a conversation, I always say, between the doctor who has a body of knowledge and the patient, a person who has knowledge of their body, and it is a conversation. And unfortunately, a lot of our medical experiences are just sort of a one-way symptom suppression. Here's a pill, here's a procedure to just kind of put a Band-Aid on what's going on. But when I always say that medicine is really a human science, and there is a person, as you said, I use that language too, 360, a full person in front of you, to be curious enough, you say challenge, to be curious enough to figure out the root cause and causes, because it's often multifactorial, of why people are not feeling and functioning well, why you were so exhausted. You could just write it off that you're, an executive and you're working hard, but there was more to that. So you need both the human aspect of doctors, who I don't think are going to be replaced by AI or robotics or anything anytime soon, or an app for that, for that measure. We're trying to sort of fit medicine into technology, or the human science of medicine, which, exactly for your story, this will never work, in my opinion, or it will be so subpar. The other thing I wanted to share is the science agrees with you on that the relationship between doctor, patient, healthcare person, nurse, patient, that relationship matters huge. The idea, because it really changes our chemistry. It's not the full treatment, but it changes our thoughts, it changes our confidence, it changes our body's ability to heal itself, actually. And that's huge. So you were incredibly insightful, and you're not a medical professional, but you went inward and started to pay attention to what you needed, which is unbelievable. And it sounds like you were successful in achieving the relationships that you needed to help you through this very challenging time.
Yeah, I really did. I found my nephrologist, who now we're like family. His name's Dr. Rami Hanna, and he can't sleep if he doesn't solve, a random issue, let alone a medical one.
I get it. I understand.
Get along.
Like a pit bull, like chasing down problems. Yeah, I get it. I could be accused of that as well.
Right? Same here. So like, we get along great.
Yeah, yeah.
He was amazing. I had to go on dialysis for 4 years. And he was amazing in explaining enough of the process for me to get an understanding, but leaving off all of the things that were disempowering. So we had a really great agreement where I don't do averages, I don't do statistics, I don't do, medians. I'm not into any of that. And I'm only into information that is going to help me make a decision for the next step of whatever we need to do. I'm not into long-term looking down 7 tracks, like none of that. So we got a really great communication balance, and it wasn't without friction of getting there, but like all good relationships, we had to figure it out. And he says, I taught him the art of advocating for his patients in a way that meant every single door needed to be broken down. And if there were more doors, if there were no more doors, he had to find more doors. And so to really give him that perspective, that's his feedback now. And he's still my nephrologist to this day. So 4 years of dialysis, I would go to dialysis. I had an outfit, which was a maxi sundress, and I had a beach bag that I would go into the dialysis unit. And every single time they'd go, where are you going? Like, you look so glamorous, because it would help me change my thought process. I'd be like, normally I'm at the beach. So instead I'm coming here and I'm pretending like that's where I'm going. Or if it, my afternoon sessions, I would take my work in and I'd have a notebook and a phone and diary, and I'd do conference calls from there. And I really made it feel like this is integrated into my life in a way that empowered me to not feel like I was sick. And that was the most important thing. I actually would say to them, don't call me a patient. I'm just a person going through this experience. You've got the medical part. I've got the mental and the physical. And together, we're going to get through it. But I'm not your patient.
Exactly.
Ever. Don't put a placard up with my name on it. Don't want any of that in here. Don't get
You're a human being. It's a human science. There's a human being. When you started to say before about the research is important, because that's how we get, medical developments and new technologies and, new information. But you're an N of one. You are one person. So the personalized approach that works for you, again, can never be an app or a one size fits all, if you will, kind of experience. And I love that you I want to see this maxi sundress now. So, and I love the beach also. So I totally understand that. I'd be there with my kombucha as well.
Exactly. I got it like I had blankets and I had a whole setup. Exactly.
I love it. I love it because you're bringing that is just sort of a beautiful image of self-care. Is I am going in and I am not sort of shedding or shredding, my life before I enter this probably very scary, exhausting, no place you want to be. You'd rather be at the beach, right? So you sort of made it work for you in a personalized way, which is like a beautiful, I'm going to remember that image. And if people can remember that, that you're not powerless. That's why we started this podcast. Power to the patient, shift the balance. And it's a conversation. We all need each other, right? But there are things that you can do to keep whole, even through very, very challenging experience. So if we could, because there's so much else we want to learn from you, fast forward to, so 4 years, I think you said, of dialysis. And then you had
I had a potential donor who was an altruistic donor. She is a teacher, a public school teacher in Virginia. She's an amazing human being. And she popped up like this ray of light and said, I've got you. I'm going to be your kidney donor. We're going to get this done. And I was like, who are you? And where did you come from? And I'm so excited. And it just was so great. Her energy and, my energy and the doctors, it was like, yes, we're finally, there's a light at the end of the tunnel. It took 2 years to get her clearances done, which is very different. Normally it takes 6 months to 12 months. We had COVID in between, which delayed her final tests. And in that process, kidney transplants were elective, or they are elective. And so when COVID hit, they were all on hold.
Yeah, because we filled up our hospitals with COVID patients. So elective surgeries on hold. Wow. So that's quite a barrier. Yeah.
It was a huge barrier, which, as you can imagine, I was on level 20 about, and I kept having to bring myself back down to like, I've just got to take it in. And so by this time, it was August 2020. She got cleared, and all I had to do was a CT scan and a stress test. I do my CT scan. The doctor calls and says, Shana, your right kidney lit up like a Christmas tree, and there's 70% chance that it's cancerous. And I was like, what? Now that we've gotten my donors ready, we're 6 weeks out from setting a date, and the same kidney we've been looking at for 5 years at this point, now it has cancer? What is happening? And so I thought, I'm dead. For sure, I'm dead. Like, this is a sign from a higher up. Wow. I'm not going to be here. 2 days later, the cardiologist called. His name's Dr. Geft. He's amazing. He called and he said, forget the kidney, your heart's failing. And I thought, for sure, there's no other sign than, like, there's 2 signs now. No one survives this. Nobody survives this. This was at the end of August 2020. And I thought, I'm dead. I'm completely done. So I'd gone to see Dr. Geft. He said, where are you right now? Turn the car around, come into my office. I will wait for you. And what was beautiful about all of my doctors is they really got that my experience in working was keeping me sane at that time. So they would reshuffle things and figure out how to make it work for me to be able to be there during work hours. Sometimes they'd wait late and say, you could be the last patient. It was super accommodating. And this day he was like, come in, come and see me. We're just going to figure this out. So I went in and I said to him, just so you know, I can't take another thing mentally. And he said, we don't have to worry about anything. I've got a game plan. You live your life. That's what we're going to do.
Just removing that burden from you. And he was going to figure it out.
And he said, the first time I met you, I got the sense immediately that you were put on the planet to do really big things. And that my job was to keep you alive for you to do those things. And he said, I plan on doing my job.
Amazing. Beautiful.
I was like, I can't even, like, I just thought all of the selection I'd done had me in the perfect right place. And he said, we're going to take one thing at a time. First things first, we get your kidney out, confirm it's not cancerous. And then after we do that, we then see if we can get your heart up strong enough, because first we've got to get your heart strong enough to get the kidney out. Then we get the kidney out. We say it's not cancerous. Then we put you on, get you cleared to get a heart and kidney. And I was like, I'm dead. I'm totally dead. And he goes,
so
no,
much. So many hurdles. Like, this is just, and worry about incredible. Yeah.
I thought, really, this is never going to happen. Like, there's no way.
Yeah. What are the chances that it's all going to align and you're going to have a happy ending?
Every single piece.
Slim. Yeah.
Very slim, right? So he said, how are you feeling right now? Suddenly he stopped and he just said, talk to me. And I said, well, I feel like I need to spend all my money, curse out every person I've ever wanted to curse out, drink a whole bunch of tequila. And he said, well, I plan on keeping you alive, so all of those people will get retribution. So we don't want to just hold off on all of this. And he said, go live your life. I will text you. The minute I text you and say, be here or be there, get this done, schedule this, etc., you do exactly that. You don't think about this anymore. You do exactly what I've told you and then live your life. I'll text you again, you do that, live your life. And that's what we did. So we were able to get my kidney out, get my heart strong enough to get my kidney out, confirm that it wasn't cancerous. So I was like, okay, maybe this is now back on track. Like, we're now looking good again. And one of my best friends said, oh my God, Your kidneys failed on Christmas Eve, 2015. And now you're going to get your heart and kidney on Christmas 2015. And we're going to make a Hallmark movie. It's going to be amazing because you're a Christmas miracle. It's what has to happen. Because 2 Christmas events, it's going to be amazing. And so I called Dr. Geft and I said, listen, we're making a Christmas movie. So we need this whole thing to happen by Christmas. So we have to speed the whole thing up. And he said, it's not really how this works, but if anyone can do it, you can. And I said, okay, that's what we're doing. And so I had this second burst of energy. And so he gave me the extensive list of clearances. I scheduled everything. For some reason, doctors were available. People had canceled. They had one spare appointment that afternoon. Everything just came together. And this was in the first 2 weeks of December. December 22nd, I got admitted into Cedars-Sinai. They put me on the list as a level 4 on Christmas Eve, which meant 6 to 8 weeks admitted in hospital, and it would take about 6 to 8 weeks. And Dr. Gav said, we've done everything we can do, and now we pray. And I was like, that's what we've got to do. I've done everything humanly possible. And at that point, I was ready to die, in the sense of like, if that's what was meant to be, I really have gone above and beyond. And the group of us, all of our doctors, have gone above and beyond. And we all just let it go. And Christmas Day at 10:30 p.m., they called and said, we have a heart and a kidney for you.
Oh, incredible.
It was like,
incredible.
So they came in like, this is amazing. We can't believe it. So the next day surgery was set. The nurses said, you're our Christmas miracle. They're going to want to take so many pictures of you. So we're going to braid you up and make sure you look hot after surgery. And I was like, perfect. You're totally speaking my language. We had such a great relationship. Like, we really bonded. And what was beautiful about it is everyone was celebrating. The doctors came in and they were like, oh my gosh, we can't believe it. It was the cardiac surgeon. He's been doing it 30 years. He's done over 5,000 heart surgeries. Dr. Geft, who's been a cardiologist 20 years, his father 40 years at Cedars-Sinai, and the anesthesiologist, which was Dr. Kaveh Nawab, and him and I had bonded. He'd done 2 of my previous surgeries. And so the 3 of them were like, we're so excited. This is going to be amazing. And as they're standing there, I flatlined. And that's when it became a true miracle, where my heart was set to stop on December 26th. And they gave me CPR for 2 minutes. I had what culture calls an NDE, where I saw the hallway, the light. I'm not even religious like that. And here I was standing in the hallway, and I knew where I was because I felt this overwhelming sense of compassion for every single emotion that we experience as a human being. Like, what a gift it is for us to feel all of it: suffering, pain, joy, the whole array of emotion that is available as a human being. And standing there was Jesus and God. It was the whole thing. And I came back through what was 3 phases for me in the journey of flatlining and coming back. And I sat up after 2 minutes of CPR and said, guys, relax. I just took a little nap. Where were we? And they were like,
still empowered. Still empowered and controlling the situation. Love it. Yeah.
It's like, we have no clue what's going on. The nurse was like, you're like a poltergeist. She was like, I don't know what is happening.
Were you guiding Jesus and God as well during this situation?
Right? Definitely not. They for sure had a plan in mind, clearly. And they raced me to the OR, kept my heart beating manually. And sorry, I'll say, right before I went under, I grabbed the anesthesiologist's arm and I looked up at him. He was trying to put me under really quickly. And I said, Kaveh, you've got me, right? And he said, 1,000%, we've got you. I'll see you in a minute. And he was tearing up. He had tears rolling out. And I just thought, they really do have me. Like, I really felt like this was a group of people that had just come together with a one mission of keeping me alive, and everything just worked. And so they kept my heart beating manually for 3 hours while my other heart was flying in a helicopter, landed on the roof. It was the whole scene in the movies where they run up and get it and bring it back. My kidney came a few hours later. And then 3 days later, I was taking my first steps.
Incredible. And here you are today telling your story 2 years later. Yes, about 2 years. We're coming up on the holidays. Yeah, we're coming up on Christmas. I mean, I can't think of a more exciting, amazing, beautiful story. And I feel blessed, honored, incredibly lucky to be having this conversation with you after what you went through. And I'm super grateful for the support that you had, but I don't think it was by accident, because it sounded like you had a big hand really in what happened to you, which is probably something you probably doesn't happen for everybody, by the way. So I just want to acknowledge that. Sometimes we're very passive in our what comes to us. And my goodness, you had so many challenges and hurdles in front of you, and you just kept on going and kept caring for yourself with an amazing team around you, which here you are. Tell me what your, clearly you have many, many superpowers, because this is not a usual story that we have. What do you think what would you like to share with other people who feel like giving up, who feel like they don't have control of themselves and their health? And I'm also curious what you're doing about your health at the moment, because we try to sort of have impact on people caring for themselves, in the best possible way, so they can reduce. Yes, sometimes it's genetic, but sometimes, our choices and our influences have something to do with our good or bad fortune, right? So I would love to hear more about that in sort of today's living. Like, what are you thinking about? What are you doing? I mean, clearly you've impacted so many people by sharing the story, and our listeners as well. But what can you share, please?
Yeah, I think on a day-to-day basis, what I'm most intentional about are two things. I don't prescribe to any guilt, shame, embarrassment, any of that. I've intentionally worked through those emotions and I get them out of my body. So really believe that those emotions, your cells remember them. So Absolutely. It's acupressure, acupuncture, things that, it doesn't have to be those things per se, but movement that gets emotion out. I'm a huge proponent of. Very, very big.
You may not know this. I'm an osteopathic physician, and I do manual work on my patients. Usually people come to see me in pain. I'm not a transplant surgeon, but I see people in pain, and just the manual and our traumas and our experiences and our stress, it lives in the body. So what you say, energetically, if it's whatever, I yoga, running, breathing, like we have to, and first of all, the awareness of these things, and the awareness this is just sort of good, healthy hygiene.
Yes.
Of not letting these things get stuck in the body, we'll say. I think you're saying the same thing. Yes.
Exactly.
Yeah.
I don't boot camp myself. I'm not like, I'm going to work out 30 minutes every day and do it. Like, none of that anymore. I literally, and the second part is I listen to my body. If I needed to eat right now, as amazing as this conversation is, I would figure out a way to
give us 3 more minutes. Where
but you know what I mean? Like, it's one of those things where it's like, if I treat myself like a toddler. Like, if you had a 2-year-old that was hungry, there's no way you and I'd be able to continue the conversation. It just wouldn't happen, because the toddler would be like, I'm eating, period. Like, I don't care what's happening in the world. Or if they need to pee or they need to do something, like, it has to be in that moment. And I do my best to treat myself like a toddler. If my body needs something, I get it for it. And that can be a range of things, fresh air to showering longer than I normally would, or whatever it is. really being in tune to that. So that's a really big part. And that's on the smallest of decisions, like we talked about, the daily decisions of it. Not necessarily like, I'm going to juice for 90 days and do this big thing. It's more about like every single day, those little moments where we might put ourselves second.
Yeah.
Actually, no, I'm not willing to compromise the fact that I am thirsty. So I'm going to go and take a break when I feel like I can't, or whatever that is.
Right. Not letting it rule you, but actually make the intentional, first of all, paying attention to the signals of the body, because I like to say the body doesn't lie. The mind doesn't lie either, right? And we can't run away from these things. So I love what you said, no shame, no guilt, because that sits with us as well. And that could be devastating and destructive.
Right.
We have to sort of, be compassionate with ourselves, because as you're being compassionate by sharing your story with the intention of other people sort of hooking into these ideas, right? You wouldn't be able to do that if you weren't compassionate with yourself first. So that's not being selfish. And I think a lot of people in this, self-care word gets kind of knocked around a lot, but just at least putting yourself on the same team as other people, right? A lot of people put your oxygen mask on first, or there's many ways to say that, when a lot of us are just on that sort of treadmill of either work or the hedonic treadmill, we talk about, just grabbing pleasure at every moment, but just being still, and what do I need? It's so basic, but we're so marketed out of these internal conversations, which often lead us astray and lead us to poor health. So
exactly. It's all part of it. It's all a combination. But those two things have been really big for me. And then I'd say the third one is connecting with something greater than myself, outside of myself. Having faith. No one really broke it down for me, but my grandmother had a one-liner that I still hold on to, which is believe in something greater than you. So that when you are in a situation where you're like, I've done everything I know how to do, that you've got a best friend. Sorry. That you've got a best friend that is right there, that is a higher power from somewhere. It doesn't matter what it is, but that is outside of you, that you can know that does have your back. And building that relationship, truly building a relationship, whether it's with nature, the universe, Buddha, God, whatever that is for you.
Yeah. Agreed.
But building that relationship is really important, because you're only one person with two hands. And, there's a certain set of circumstances that you may come across where you don't know what to do. And it is out of a human realm. Mine is a good example where we really did everything humanly possible. And I'd say that the last thing is, you are the CEO of your life. You can figure out who is the best team to be around you in every single circumstance. And taking care of yourself medically is doesn't have to be different to that.
Medically, mentally, physically, and using the CEO metaphor, which I often use as well, is investing. Right? If you're thinking about business and investing in yourself first, right? Investing, it's another sort of business metaphor, because we started out with, running around like a busy executive, but investing in your health is arguably will bring the greatest returns, and that's mentally and physically. And I just hope for yourself that you're getting enough beach time, because you love the beach. So I hope you're making time. I hope you still have that beautiful maxi dress you were talking about, and that you're getting to the beach, because vitamin D also is really good for you, and getting that sort of connecting with nature. Exactly. I can't thank you enough for this absolutely incredible conversation, and you've inspired me. I understand, where you come from, even though I haven't been from the same experiences, but the challenges and the faith that continued, that you were just going to, you weren't going to give up, you're not giving up, and you just brought this, you really sort of handpicked, you're like a casting director, if you will, for the team of caring, skilled people around you that took amazing care of you and gave you a second life, really. You know, and but you kind of willed it to happen. There was you didn't give up, you didn't push it away, you just knew what you needed. You collected all of these skilled and caring people, and here you are passing on the story for other people. And I know people will be inspired to at least think about all these amazing things that you've done for yourself and are continuing to do. So I cannot thank you enough for having this conversation. I don't know if there's anything else you want to share.
No, thank you so much. I really appreciate it. You know, you said previously that this doesn't happen for people. And I hope that in me sharing, the biggest message that comes across is I'm super normal. The superpowers I have can be learned. And that there is things in here that every single person can do, whether they speak English or not, whether they, you know, whether they're from this country or not. There is absolutely things here that I've done that everyone can do. They just almost need permission to, and to know that it is available to you to actually run the way that your medical team goes. So thank you for having a platform to be able to have me share.
Oh, it's a pleasure. Being an advocate for yourself, as caring as people can be, if you don't know what you need, you know, and you want, you can't really organize that, you know, so well. But, you know, never giving up, going forward, and connecting with yourself, you know, in what you need to stay healthy and happy, and, you know, continuing this beautiful life. So thank you for being part of this, and thank you so much for sharing. It's really been a pleasure.
Thank you for having me.